Okay,
Thank
how's
you.
everyone doing today?
He ain't new to this. He true to this.
Yeah.
Actually,
You want these?
I do.
Sure.
My pants are cute. What size you wear?
10.
Yeah. Okay. Yeah.
Thank you so much.
How good are my eyes supposed to be to see that?
Okay, girl, you got it. How's everyone doing today?
I'm doing great,
settle down.
actually.
Okay.
It's been actually, well, I was off yesterday, so
On a Monday?
yeah.
She works all weekend, boo.
Yeah,
I
unfortunately.
love that for you.
No, I don't.
Okay, I mean, okay. Or not.
Would y'all ladies like to introduce yourselves?
Sure.
I'll let you go first.
Okay. Hi, everyone. My name is Jimmy Nash. Pronouns are he, him, his. I serve as the Senior Manager of Programs Training and Evaluation here at Equitas Health.
What's a fun fact about you? Like, less informal.
Sure.
Or less formal.
Fun fact. I really like roller coasters. I'm a really big roller coaster fan.
I can see that for you.
I just went to Kings Island. I feel like after like one ride, I'd be over it.
Didn't she not ride anything? Like,
No, I never said that.
you know the girls that be like, girl, hold my bag. I'm finna go on this ride. Like, you that girl?
Chris.
Yeah, I ride the rides.
Oh, you rode the ride.
Yeah, I rode like 5 or 6, but I was like, had like a
bag
headache.
carrier when you go to the place. Like, grandma, come, just hold our bags while we go up there.
And I might be that person because I like roller coasters, but up to a certain height. Like when we get like
Not the
200,
top- the
300, I'm not
dragster?
doing all that.
That's
I don't
the
think
point?
humans are meant to be up that high in a little rocket. No.
Someone, you want to introduce yourself?
Sure. My name is. Where do I look? Do I look in the camera?
That's a good question. I was gonna
Girl,
ask.
Yeah, actually, where do we let?
I mean, this is. Thank you so much. You want
I'm gonna hurt you.
Girl.
Hi, everyone. Closer. My name is Sawaun Blakely. My pronouns are he, him, his. I am born and raised here in Columbus, Ohio. I'm a father. I am a advocate. I work at Equitas Health. I am the volunteer manager over the entire Ohio region. And I just came to Kiki with the girls. Or no,
With
the
the bros.
With the bros.
It can be girls.
We are the
too.
girls too.
You know.
Hey, girl.
Yeah.
Okay, period.
Wait, you guys are you guys okay saying girl?
Yeah, like
Yeah, that's fine for
y'all
me.
don't
Yeah.
like have a like.
Oh,
you know
this
what
is
I mean,
open
gender?
form. Like
Yeah.
no
Yeah,
restrictions, right?
Okay,
Yeah.
you're open book,
This is
right?
the very first podcast that I am on, so I'm so
Same.
excited.
Oh, okay. Welcome. Yeah,
Welcome.
yeah, we're glad you're here. We're like popping your cherries.
Honored.
So we the newbies and y'all.
So y'all cherries is getting popped. Okay.
We won't go there, but
Well, I mean,
Podcasts.
podcast, honey, because yeah,
Yeah.
I really wanted to bring y'all here because, like, a part of the work that we do, as well as just like navigating spaces in the community, being like community advocates for like community health and things of that nature. Obviously, it's centric around HIV and HIV awareness, HIV prevention, and something like a topic I really been wanting to talk about on the platform is how HIV stigma affects gay men of color. And my first question really to you both, and well, I mean, Chris as well. How does HIV stigma affect the mental health and well-being of gay men of color that in your own experience or like those who, friends, family, things of that nature? So yeah.
I feel like a very immediate. I feel like a very immediate thing, and some of this is just research I've seen, and just done. We know that stigma severely impacts mental health. We know that people who are living with HIV are typically having higher rates of anxiety and depression, especially compared to like generalized populations who don't live with HIV. And a lot of that is because of how entrenched I think stigma is within our society, especially regarding HIV, both for general population and then also specifically in communities of color, especially Black communities. We know what that looks like. So I feel like in general, it's just a heightened awareness of being an other in a population that already is othered within a population that's generally othered, right? So going from being Black to being queer identifying to being someone living with HIV, it's like you're becoming an other of an other of an other. Which to me makes perfect sense why we see those higher rates of certain mental health conditions.
I mean, how do you think we like dismantle those like stigmas and those barriers? Because quite honestly, for me, in my perspective, I don't feel like I was exposed to those things and really was culturally aware until I started like being involved in the work.
Exposed to what?
To like HIV stigma or like in its like entirety, not just like, oh, I knew that it was something that was attached to gay men specifically, and that was a stereotype, but everything else that is centric around it, those things I wasn't necessarily aware of.
Like how they've been treated.
How they've been treated, like those social drivers of health, and that's like healthcare talk, but like I never took those into account how they affected me as well.
Yeah.
Like I didn't have I guess it goes back to like health literacy or like just like your own cultural awareness of like your own perception of like what reality is. Like that's not something I was exposed to. It's not something it was talked to me about until I was in my 20s. So like, what's your experience in that?
Well, I would say the same for me. I didn't experience the stigma in early years. I was diagnosed in 2006, so after high school. So mine was kept a secret. Would I say a secret? Well, yeah, it was kept in the family until I was ready to tell my story to everyone. But I didn't experience like what some people say, oh, I can't eat after you or things like that. I did experience stigma when it came to dating. Yeah.
So like to that, so you didn't like, I know there's people who have talked about like they were really shamed from their family. You didn't have that experience?
No, my mom was like my rock as soon as I told her, like she was there. Did her education, so I would say that for herself on what HIV is, HIV 101, I will say my family went and did their own education. So they were educated on it because they had no knowledge of it and I had no knowledge of it myself. Yeah.
Do you feel that you felt like, I want to say...
This is for me, everything. Okay. No,
Oh, no, I was just going to say, do you felt like you felt extra loved by your family because they went and did their own research about something they weren't aware of?
I felt the love because they were there. They were asking the questions. My mom was at the doctor's appointments with me.
Yeah.
Asking my doctor the questions that I should be asking. So I felt that love. I felt that support. I felt that community, not only from my family, but from my close friends. You know, that stigma we deal with in the community, like I'm scared to tell my status or things like that because of what we were taught, like, oh, he's gay, he has a house in Virginia, HIV.
What? Oh, who?
HIV.
Girl, I have never heard house in Virginia. That is wild. I am not going to hold you.
So your baby. I forgot.
I was like, what does Virginia have something to do with that?
No. So that's a stigma. You cannot. So growing up, it'll be like, oh, he has a house in Virginia.
Okay, that's shady.
Not a house in Virginia, maybe on the beach. Okay,
but HIV, house in Virginia.
What? So okay, well, shout out to you for being a long-term survivor. Thank you. Okay, celebrate that. And Jimmy kind of talked about this. How do you think cultural backgrounds influence the perception of HIV within communities of color? I think that's something that I think, from my perspective, that the only knowledge of HIV I had prior to that was from that experience, which was, oh, it's a gay man's disease, or like you said, like even like, oh, if I eat after you, can I contract it? Those.
So were you being educated while you were being sexually active, or no?
No.
I think. Go ahead.
Sorry, I feel like the same way as you, Fran, where fresh, early 18, 19, that's when I actually first had sex. And then shortly after that, I got into like a long-term relationship. So I wasn't even like aware of that. I was aware of HIV. I feel like on TV it was always shown it was this like gay man's, only gay men could get it. But then as times change, I feel like more educational marketing materials out there, you change. And I feel like obviously getting into this work, it changed my perspective about the whole thing. The more education you have around the topic, the more you're going to be more aware about it. So, yeah.
I feel like for me, education-wise, I don't know. I feel like for some of it was self-learning, and I know we're going to get to like media representation a little bit later, so I don't want to skip ahead too much, but I feel like part of it for me was self-learning, because I remember coming out and that was like one of the first things that came up was like, well, you need to be aware of this. And I was like, okay, also, I just said a very big thing to you. So how about we focus on that and not like jump to, to that conclusion. But I also think that there's something to be said about, there's a reality of recognizing that people that grew up in the 80s and 90s, the world, it was kind of similar to what we saw with COVID, right? Where the world was kind of on fire, at least in the U.S., specifically in the 80s and 90s, where we saw people just passing away from this thing that no one really knew about. And immediately, it did not help that many large, what would be considered official places of education, like the government, right, or like scientific kind of communities, were immediately pointing fingers, right? I tell people all the time that HIV was called GRID, right, gay-related immunodeficiency. So it was, from the start, talked about as something that was only for gay people, specifically gay men, right? So we think about the fact that there are people from the 80s and 90s still living today. And unfortunately for a lot of them, it's really hard to unlearn what they were taught, because they were taught it from people that they thought they could trust about this information. Especially when we consider that sexual education is just not what it should be, has never been. And so if you're learning education through word of mouth and all you're hearing is that this one thing is focused on these two group of people, I can understand speaking about it from a form of like, be wary of this. And you're saying that out of concern, as I think many parents do. But it's also important that you're informed about what that really means and recognizing who can be affected by it, which is everyone, right? So I can recognize some of it from a sense of, I was only taught this, so this is all I know. But also at some point, you're an adult. We have to expect more of you, especially if you're someone engaging in sex, and especially if you're someone who's a parent of someone engaging in sex.
Yeah.
Okay, Dr. Nash. I think that's right. Okay. Period. Anyway. I live for that. Like, okay, so I have a question in terms of like access to care. So like, Sawaun, so when you were first diagnosed in 2006, like how has like HIV care from then to now, you receiving your care, how's it kind of like transformed for you in your experience? Because we have like technology and medicine has come such a far.
When I was first diagnosed, I went to Faces at Children's Hospital. And that's where I like started my care. And I hated how they put our last names on the door. Like at each room, it was like your last name. So like as you're going to your room, you can see like, and I hated that. So I went like 3 times, and then finally I approached them and was like, I do not like this part about my experience. Since then it has changed, but that was like one of the, wait, what was the question? I'm sorry.
How has your HIV care transformed over the years?
Oh, because I get the rambling. I'm sorry.
Girl, she got away from the plot.
Like, she definitely walking through the door, walking in there.
You listen to our Nationwide, basically.
Yeah.
Love that for us. Thank you.
Who was at Children's Hospital with you?
I'm sorry.
I had the visual too.
I was like, damn.
So,
well, I got the name on
it
the
has
wall.
changed. I will say that changed about it. And there's easy access now. That's why I tell people there is mental health for it, because I know I dealt with a lot of depression, being on medication, nightmares, mood swings where I would stop my medication and then I would get sick and then be like, okay, my last straw was me getting pneumonia from me just not taking my medication. But that was because I wasn't going to therapy. I was just taking my meds like, okay, I have to take this to survive, but I wasn't taking charge of my mental health in whole. Like I have access to all of this. And I didn't think I did, but because I wasn't involved in like children's and the programs and the resources, I was just going for my appointment and going home. But the access that there is now is way more access now than it was from when I first was diagnosed.
So like now you obviously have sit in open forums and you talk about your status and things of that nature. But like previously, before that, even before working in this work and things of that nature, not only was it difficult for you to have those conversations and like in terms of like dating, like how would you navigate those? And a lot of times would you be overthinking it more than you thought?
You said now with dating, how has it been?
Like what's the differences? Like when you like first were diagnosed, or even like navigating those years in between until now.
So that was one of the hardest parts of dating for me. I now go in it like an open book, but before I would wait to tell my status, and then I've dealt with guys. Where the camera at? I dealt with guys who was like, you should have told me, even before we were sexually active, because I am that shit. So, you know, we get deep in a relationship. I dealt with guys like, you should have told me earlier. I fell for you. I'm in love with you now and things like that. But that was a barrier for them. Like, they couldn't handle that. So now I'm open book. I go in it straight up. Like, this is what it is. Take me.
Okay.
Love me or hate me. But this is my story. So.
Do you think that, you know how in some states you don't have to tell your status to people, where in here in Ohio, it's like you get criminalized for it? Do you think that people in different states might have a different dating experience because of that, since they're not obligated to say their status? Or would you still want to be open with
I would
your
still want to be open. Just in case we go out and have a few cocktails and, you know.
Heavy on the what?
Heavy on the cock. I'm sorry.
I feel like those, just like in speaking of those laws, it is such a. I'm gonna try to keep this really short.
Yeah.
I'm gonna try to keep it short.
Yes.
Because I feel like those laws they're ridiculous, right? And for those that don't know what we're talking about, so I think there's 35 plus states who have what's called HIV criminalization laws, and so these are laws essentially that run the gambit of criminalizing someone living with HIV and not disclosing their status. So here in the state of Ohio, it is a felony assault charge. And there's so much wrong with them from the very beginning, with putting the responsibility only on the person that's living with HIV to disclose. You also have to prove that you disclosed, right? So if you meet someone at a bar, as people do, right, or just anywhere that you want to have sex with them, as people do, as any adult would,
right?
You have to prove that you told them your status and some type of documentation.
That's so crazy.
It's ridiculous, right? So word of mouth is not good enough. You have to be able to prove it. Even if a transmission did not happen, you can still be charged with it. So just because you didn't disclose, just because you can be undetectable for 20 plus years, right? So viral load, so low, you cannot transmit it to anyone else. But because you did not disclose, or you can't prove that you didn't disclose it, you can be charged with that, right? So they're antiquated to such a degree that it does more harm than good, right? Research has shown that people who engage in sex work even, right? Because you can only be charged with it if you know your status. So if I don't know my status, I can't be charged, right? So you're completely taking away the public health benefit of people knowing their statuses and reaching undetectable status, right? And maintaining that by criminalizing them just for knowing what they are and recognizing the stigma that exists around it. So it's a little ridiculous. Again, I said I won't keep it short. But
No, I get that. I feel like what you said.
First thing you do when you're with someone, have you been tested? Is that a question you ask?
Prior to me working in this field, no, I don't think I've asked those questions. I feel like we talked about in a different episode where, I don't know, I just wasn't asking those questions, where now I am asking those questions. So yeah, I don't. Maybe prior to me not being on PrEP and being not misinformed and educated, I would someone told me their status and we were going to have sex, I might have looked at it differently than I do now, because I've had sex with people that are positive. So
shout out to Aptitude.
I do take Aptitude. I like the shot.
Yeah, me and Chris both got the shot. We get it the same days. Our periods are aligned.
Did y'all sync that up together?
I don't know.
No, it went.
I don't know why. Real bros.
I'm like, yo, what's your appointment?
Y'all might go in the same room.
No, for real. We got the same wax. We go to the same wax day for a few months too.
Oh, y'all real sisters.
Yeah.
They were sisters. Yeah, y'all.
Look, I mean, we work the same days.
Yeah, she just moved. Her new place look good. Y'all want to get your butt waxed? Hit up our girl Melissa.
There's spa.
Shameless plug, please.
I'm gonna drop the link in the bio.
Booty hole.
I don't know.
I ain't getting no distance. I didn't even get no referral.
Yeah, no say. So one of the things for me, and as someone who's not living with HIV, but obviously seeks out healthcare. I think the biggest thing is like culturally competent and inclusive spaces. What do you think that healthcare providers could do to make sure gay men of color are experiencing an inclusive space when they're going into it? Because I think a lot of times, like, we don't, whether it's representation in the staff or representation of like even like marketing materials, I don't think boys see that in spaces. What is your experience in that?
Let's not have last names on the doors.
Okay, take the last name off the door.
You know, I feel like that makes a lot of sense, right?
Yeah.
I also feel like and even like in our conversation, obviously we're all cisgender men, so there's that to be considered. But I think that even ensuring that marketing materials does not only show cisgender men, right? Because again, all you're doing at that point is perpetuating this idea that Black cisgender men or Black queer men are the only people that are affected by this virus. Now, we are seeing with the highest rates, and there's a number of reasons why, but many people are affected by this virus. Representation around it should be increased to ensure that other people are understanding. I had a conversation with a client one day about this, and she was like, I didn't know that I could take PrEP, right? Like, I didn't think that was something for me because I just did not see, she's a Black woman, right? 30 years old, right? She was like, I just didn't think that it made sense for me because I never saw someone like me on the marketing material, so why would I think that I should be taking this?
You should have said we are all HIV possible.
Okay.
I didn't have that quote at that time, but we had the same discussion without that piece of knowledge.
I feel like also that since times are changing, where like the poly is becoming more known and it's becoming more open, where people like cisgender women, they're more open to getting that because of their open relationship statuses and stuff like that. I've seen that they've come in and said that to me.
I think that is like, that's like, I mean, it's the same avenue. Because I was at the bar. I'm gonna tell y'all a quick little story real quick. Because that, what Chris said just triggered
Those
me.
stories don't be quick. So we go.
No, it's gonna be here, quick. So I was down.
You know how
Paint the picture. Paint the
how
picture.
Black
Okay,
people are.
I was down to Kona Grill last night having me a little, like an espresso martini. And I was talking to the bartender. She was one of the girlies, one of the bros too. And she was talking about she found out because she was going out to Union that her and her man was in an open relationship, but it wasn't open on her end. And but it came with like the conversation about like sexual health. They kind of went back to the, I circled it back around because I was like, oh girl, you should come get tested, bookie butt. And anyways, she was kind of saying some things that was kind of suspect in regards to like, well, it comes back to like the language in terms of stigmatizing language, in regards to, okay, producer, I was confused. Are y'all okay?
Go on,
okay. Stigmatizing language around HIV. So like, using like words like dirty and things like that. So like, as allies or people not living with HIV that may be doing the work, how do we advocate for, those who we know is living with HIV, living healthy in those spaces, like appropriately?
When you hear things like that, you use it as a teachable moment and say, like, when you hear someone say, oh, she dirty, and I still have to, and it's sad that we have to at people's big age, but it's just like a teachable moment. Like, that's not right to say. Ooh, can I say it?
That was gonna bleep it out. Just go ahead.
Okay. So I'm just saying, like, in terms of derogatory words like faggot, dirty, things like that. When you're around the girls, you have to clean those up and teach them, like, girl, I know that may be appropriate. What did we just say before we went online?
We also redefine words. I feel like for me, I've also had to check myself and how
Not saying like that. I'm saying like
yeah, girl. No, sometimes
Because he was gonna be ready.
he was ready. He was ready to shoot.
no, like
Put it away. It's okay.
my thing was,
Oh, bros.
I had to check myself in terms of regards to like the language I was using, not necessarily around sexual health stuff, but like just in general how I approach certain things. Like I cannot be saying crazy off the wall shit because my bad. I can't be saying crazy off the wall things because not everything, like the conversations you have amongst your homegirls or people who might be comfortable having those discussions or using certain terms and language and words that maybe affect people differently, just being more socially aware in certain spaces. That's something I've learned when I'm transitioning in my age. Closer to 30 than 20. Yeah. So Sawaun, you had mentioned when you had first started getting into treatment that you were kind of just going to your appointments and that was kind of that. What kind of was a shift there? Like, did you start going to more like support groups? Was there like any like community initiative you started being part of? What changed you for like, okay, I want to be more active. I want to talk about this openly in an open forum.
Shout out to Greg.
Okay.
GCMC. So that's where it all started. I seen the sense of the community, others coming together, those who were HIV positive and those who was not. Brothers in unity, just coming together during the week, getting it together and being surrounded by other gay men, positive gay men. It was like lawyers and doctors and just educated black men. So that's what I love to see at my young age, and I continue, Shout out to GCMC and Brothers in Unity.
I wish I could have been a part of GCMC.
Was that before Project Inc. or after Project Inc?
Before. So, shout out to Project Inc.
Yeah.
Because I think when I started Equitas, or I was an intern 2018, I think. I think it was right when GCMC had just ended. And so I remember my internship was under Dewan, who was like a very influential in that space, and he would tell me a lot about just how much that space meant. I think even a couple weeks ago when we did the focus group, people were talking about just how much Randall, right? Like they really helped build a community in Columbus for queer black men, regardless of status, but of course allowing and providing a space for people living with HIV to feel okay and welcome. And I think obviously we've seen different iterations of that with Project Inc. coming down, and then I think Brothers in Unity is maybe the ultimate mix of those two.
Yeah, I think it's a combination.
I think GCMC was much more of like a space.
Yeah, it was like you can come in, take a shower.
Right.
You can. It was a lot of homeless guys that would come in and just sit during the day and just play games, eat. So
Where was the building at?
It was down the street
by Franklin Park.
Oh, okay.
So shout out to all the girls that led those programs, like with Ron, Greg, Dom Ali, all of them that really like led those initiatives. Randall, like I'm probably forgetting some people, but like everyone that led those.
The Trailblazers.
They definitely laid down the foundation. So Dwayne,
I feel like a lot of times when looking at grants and programs, especially from like national organizations like the CDC, which like Project Inc. and Brothers in Unity are funded by the CDC. Shout out to CDC.
Shout out to the CDC. We need the more funds coming in.
Just a little plug for y'all. But
disease and control.
I feel like a lot of those organizations, and again, and a lot of it is just in how grants are established. Grants, when they finally get to a program or an agency like Equitas, they've been in the making for like 5+ years, right? So the data that they're even using is outdated. The methods and modalities that they're using for outreach are outdated. And so a lot of times on the boots, on the ground individuals, like Ron, like Dewan, like all of those that really helped with GCMC and really even to this day, even with Brothers in Unity, really are on the forefront of shaping what it looks like for outreach and involvement in the community when it surrounds this topic. And so I think it's always really important that national organizations or even statewide organizations are able to not just take from these places or take from these groups and say, here's a great thing they're doing, but actually fund them, actually support them in a way that allows it to be sustainable so that we're not seeing these programs that are really needed in the community be divested from, within like 3+ years, right? Which we see all the time. So, I think it's important that we highlight these community groups that were established because people just felt a need for the space.
Yeah, I think like the work like Brothers in Unity and its iterations, whether it's GCMC or like Project Geek and all of those, I think it's like a mini legacy. Like I don't try to big it up, but like it really is impactful in this space, especially when we did our little focus group. Why'd you look away? What's the key?
Not a little focus group. Black people love
Girl, not
say
y'all
little.
Keen over there in the corner.
I don't know.
She's falling out.
My team ski team, and I'm getting in trouble
Oh.
from the producer.
I feel like you respect.
Oh, I didn't see. I wasn't paying attention. Like,
Shout out to our producer,
I'm
you
like, I'm trying to have a
guys.
moment.
My team ski
Silence
team
your phone.
Turn
because
that shit off.
it's
Oh.
on my laptop, and I need my fan.
Okay,
you know?
girl,
I need
nice.
a whole
Anyways.
situation.
Anything, what I was saying, shout out to
I'm
everyone.
sorry.
Shout out to HIV stigma reduction.
You let us stop you. We was just looking at each other.
Oh, because Chris like are you okay? Anyways,
I am kind of hot.
well, you about to write a
put on a
lie.
sweater.
Anyways, like I was saying, shout out to all them girls.
My sweater.
You know, I think, but
I'm sorry.
Jimmy, let's say what Jimmy said about like creating space of like, I think those models and just like, you know, modernizing and like trying to reinvent, but also still taking into regard what the mission is. Because I think ultimately all these spaces were created for the same purpose. Is like just carrying that forward and kind of making your own imprint. So I hope like me and my team can be able to do that, because I realized like when we did our focus group, or we're just talking to people who may be a little bit older than me or even like younger than me that went to those different iterations of the programming, it was really impactful for them. So yeah, so I just hope that can continue.
Me as
So far,
well.
too.
Yeah, you just always want to have like a we're doing the work and we want to have like make sure that we're actually making an impact in people's lives instead of like just going to work and just doing like getting a check, you know, like people do that all the time, but I feel like it's definitely rewarding to have some type of impact in someone's life from the work that we do.
But y'all are, right? And again, I'd like to think that you all know this, but maybe, and I feel like I've told you this already, right? But sometimes just showing up is enough. It's not always enough, right? Like it's not always enough, but just having a space and just recognizing that people sometimes don't even know that that exists. I think about myself when I was a teenager, and obviously I think I said I'm from Cleveland, right? So at that point,
216.
you know what it is. Having now, would I've gone to the group like Brothers in Unity? You know, I don't know if at that age I would have been confident enough to do that. But knowing that it existed, and I think recognizing that even if people aren't ready to admit it, they're always looking for representation. You're always looking for ways to know that who you are, the way that you feel, the way that you experience life, your perspective is not by itself. You're not solely on this earth by yourself. And so I think you all are doing really good work to have events or just provide a space, right, for different people of different walks of life and different perspectives and experiences to just come together surrounding their shared identity, but able to still be very different in how they experience things and able to share that. So I feel like even something like this, right, this is not something that I think was around 5-10 years ago, right? So you're doing very intentional things that allows for people to see themselves represented. So I would like to think that you all hopefully know that, and if not, then let this be the time for you to know that.
Thank you. Thank you.
Okay, give us our tips.
Yeah.
Takeaway
Y'all's
two.
flowers.
Do that one little thing. That one little thing.
Okay, well, thank you for tuning in to this part of it. I don't know what the working title is.
Kiki with the bros.
I thought it was Kiki with the bros.
No, I'm thinking of the
that.
episode.
Kiki
I
with
mean, I know
the
what the podcast
bros.
name
What's
is.
y'all's intro song? Y'all got one?
We don't know.
Do-do-do-do-do-do. Ah, do-do-do-do-do-do. Ah, do-do-do-do-do-do.
And we're out of here.
Kiki with the bros.
Do-do-do-do-do-do. Ah, do-do-do.